Hello, this is Adam with PainInMyBack.com. The interview that you're about to hear, conducted by myself and my partner Pam Knight, is with Dr. Vance, an extraordinary chiropractor out of Austin, Texas. Dr. Vance graduated from Texas Chiropractic College in 1984 and has been practicing in Austin ever since. As well as being a doctor of chiropractic medicine, he is also certified in clinical nutrition and detoxification. His practice offers physical rehab training as well as acupuncture and allergy treatments. Once again, this is Adam. Please enjoy the interview.
The first question that we have here is, obviously, what is your expertise related to back pain? If you could just talk about yourself for just a little bit in your clinic, that'd be great.
Okay, great. Well, obviously, as a chiropractor, we're trained extensively in the functioning and dysfunctioning of the spine, of the back, and all things related to that. So we have extensive education in school, and then also we have follow-up seminars. Every year we're required to have at least 16 hours seminars to keep up to date with new procedures, new techniques, all the things that go along with it. So
okay, and what? So I've been on your website. You guys do acupuncture. You do. Actually, Pam was telling me that you do some allergy treatment as well.
That's right.
Talk about that stuff if you could for a little bit, because that obviously makes you a little unique.
Yeah,
to other chiropractors.
We try to do a lot of different things here in the clinic. My wife is the acupuncturist,
okay.
And she is nationally certified in Chinese acupuncture and Chinese herbology. So she's not only the acupuncturist but an herbologist. She studies extensively. She's been to China 5 times and has worked in the hospitals in China.
Wow.
So she has a lot of experience, and she works on a whole lot of different problems that people have. She kind of specializes in women's problems. We do a lot of hormone balancing here in the clinic. She does a lot of fertility work, especially I call her a baby maker. She's really helped a lot of women conceive babies.
Really? Wow.
Yeah, and she's very, very good at that.
And what kind of procedure does she use to make that happen? I mean, that's...
Well, she has acupuncture and herbs.
Wow, no kidding.
Pretty simple, yeah. She has a whole regime that she puts the ladies through, and we've had women that have been through, spent tens of thousands of dollars in fertility clinics only to be told, well, you can never have a baby, and 2-3 months later they're pregnant.
Well, that is really, that's really powerful. It's funny. Yeah. I was going to say
quite frequently.
Yeah. So when you guys, what are some of the most common things? I mean, being a chiropractor, you see mostly skeletal issues, obviously, but what are...
Pretty much, yeah. We see mostly skeletal stuff. My practice, besides the chiropractic, well, in the chiropractic, I employ a number of techniques, adjusting techniques.
Okay.
From what they call a diversified technique, which is what I call the standard chiropractic adjustment. I do what they call upper cervical, which is adjusting the atlas specific, which is the first cervical vertebrae. That's what your head sits on.
Right.
I do a technique called activator technique. I have what I call a manual activator, which is it's an adjusting instrument, and I also have a mechanical adjusting instrument that I can use on people that some people are afraid to have the regular adjustment, or they're too sore, or there's a number of reasons. So I have a lot of different techniques available to me. I adjust anywhere from babies to very old people because I can use a number of different techniques to treat somebody.
Okay.
We also do rehab here. I have a total gym and a Bowflex and the exercise ball and the TheraBands. So we do a lot of rehab here, pre and post-surgical stuff that I get from the MDs that I've worked with for a long time. Okay. I have applied clinical nutrition certificate, so we do a lot of nutritional counseling. So we do a lot of that, and then of course Linda does the Chinese acupuncture and the
Right.
herbs. And,
let me ask you
and
a very.
You also do the allergies.
Yes.
Elimination, correct?
Yeah.
Yeah, let me ask you a question here. This is an important one. What I'm trying at all times, Pam and I should say, I try at all times to cater to the patient.
Uh-huh.
When people come into a chiropractor, what do they expect? Okay, let's stay on the back pain from here on out for the duration of the call, because I'm already excited. I know we could talk about a lot of things, and I've been to a chiropractor several times and had great experiences. Right. And I know I was a little nervous going in, but let's stay on this question. When somebody comes in the first time, what can they expect from you? You know, they're nervous, they're scared. You know, are there any needles? Are there any, you know, obviously you're talking acupuncture, there is. I know that they're painless, but what's the first visit with you like that makes you different, or that you can do to comfort people or let them know what's coming?
Well, the first thing is people come in with all different kinds of expectations.
Okay.
Some people come in that have been to chiropractors, you know, before. Other people have never been.
Yeah.
And there's a whole set of expectations that comes with each one. I always try to make people feel comfortable, you know, to let them know that, you know, we're regular people. My clinic is a very relaxed atmosphere, and I like to treat patients the way I'd like to be treated at a doctor. It's a very simple concept. I've worked many years and studied communication techniques, you know, listening techniques, all this stuff. So I really try to pay attention to the patient, put them at ease, let them know that I understand what they're telling me, and you know, I've treated lots of things like this before. And, you know, and then we just go through the regular examination and X-rays.
And talk about that a little bit, too. Like what's point A to point Z if someone comes in for the first visit? What types of things do you do?
Well, obviously, point A is first is paperwork. That's everywhere you go.
Mm-hmm.
You know, then I go over the paperwork before I see the patient. Then I go to the patient and we have the interview, so to speak. That's what I call it.
Right.
I go over the information they gave me, make sure that I understand it correctly. You know, and just talk about that. Just go through and talk about it and ask a lot of questions, you know.
So they would come in for maybe a specific thing, and you would try to address that.
Absolutely, yeah.
Mm-hmm. Okay.
Yeah.
So if they came in for back pain.
You know, I mean, I treat anywhere from bending down to pick up a pen, you know, and can't straighten up, to, you know, falling off the roof, car accidents, and everything in between.